Okay, I've got something here that probably a lot of people don't want to hear, but systemic racism is real, and healthcare is not immune to it. Hello there, fellow mortals. Welcome to another edition of FTP from the Pit Fast Track. Evidence-based, no pretense. And remember, I am an emergency medicine PA. I am not your emergency medicine PA. So I guess before we get into the meat of this, it's a definition about, or a description about what systemic racism is. And it's not something that's overt. It's not something as obvious as one person yelling racist epithets at another person. It is things that are embedded in systems within our country. And it can be within real estate, it can be within government, and obviously in this scenario, it can be within healthcare. So what particularly am I talking about? And there are other examples, but this is something called race-based GFR. GFR stands for glomerular filtration rate. It's a measure of how well your kidneys are functioning, how well they are filtering and doing their job. And we calculate this. It's pretty much part of a standard basic metabolic panel where we get your renal functions and then they calculate the GFR. Problem is, for African Americans, they calculated this differently than pretty much everybody else. They would do the normal calculation, and then with a coefficient of 16 to 21%, they would come at the final number. And this would give an inflated result, a result that would indicate their kidneys were healthier than they actually were. Why did they do this? Well, basically there was this thought that African Americans had better functioning kidneys that could withstand injury better than everybody else's. However, this was really just based on race. It was not based on biology. It was not based on any objective data. So wherein lies the problem with that? Well, when pretty much everyone, if you're healthy, it pretty much doesn't really matter that much. The problem comes with patients who have chronic kidney disease. When you have chronic kidney disease, it's a progressive issue, and your kidney functions are periodically measured. And at some point, you're going to reach a threshold where they're going to start talking about the need for a kidney transplant. The issue becomes with this race-based GFR, African American people were getting erroneous results, still saying that they haven't reached the threshold yet, when in reality they probably had. These inaccurate calculations delayed them getting the proper treatment in some cases, because the reality is getting a transplant is not an easy thing. You have to find a donor, you have to find a match. So with their numbers being erroneous and delaying the threshold, delaying them reaching the threshold to even talk about a kidney transplant, they've missed out on a lot of opportunities. And sometimes you miss out entirely. It created a situation where African Americans were at a disadvantage. Now, some of you might thinking that this might be something that happened, it's been happening many, many years. It happened many years ago, and that unfortunately is not true. This did not get corrected until 2021, when the medical establishments the medical societies that make these recommendations finally ended race-based GFR calculations. So pretty recent. So whether you believe in this or not, it is indeed there. And there are many other examples of this. This is just one of many. So that's about all I got. Remember, everyone, protect yourself, protect your crew, and I'll see you in the pit.